Hello and welcome everybody to another webinar with Dr. Mohammad Rafiq. When we always do a poll after we have a webinar, Dr. Mohammad Rafiq is the top favorite. So we have him again with us, and this time he's going to be talking about homeopathic management of febrile convulsions. I think the reason Dr. Mohammed is very sought after is his easy way of explanation, and so the doctors can easily understand how to go about such cases. Without much time, I'd hand over the stage to Dr. Mohammed Rafiq. Dr. Mohammed Rafiq.
Hi, good evening, everybody. So thanks to I Love Homeopathy and Karthik for the invitation, and thank you all the delegates for inviting me. And your support is always great, and your encouragement. I hope you will continue giving me the support and blessings always forever. Anyway, today's topic is homeopathic management of febrile convulsion. You know, we homeopaths are successful in managing fever. We can manage most of the type of the fevers, except in situations where toxemia goes beyond our control. Then we have to take the help of our modern medical friends. It happens many times, but in other situations, majority of the situations, we are successful in managing our fever cases. But there is a situation where we feel little embarrassed because patients are in agony. So we have to refer such cases, and they will have to go to other systems for the management. And most of those cases later on will start taking anticonvulsant medicine, that is febrile convulsion. So this is a case. These types of cases often uh, make us difficult to manage. So we are forced to refer. So my intention behind this seminar session is to make homeopaths aware what is febrile convulsions, how it happens, what we can do, and what we should not do, and how we can manage febrile convulsions, and when we should take the help of our modern medical friends, a neurologist, for certain types of febrile convulsions that need immediate emergency anticonvulsant treatment. So, uh, before we go deep into the homeopathic aspects of febrile convulsions, I feel we must just go through the basics of febrile convulsions. I know we are all studied that in a college, and we all know a little bit about that, but it's better we just go in brief about the basic aspects of the febrile convulsions. Okay. So, what is fever? We all know. Fever is a rise of body temperature above the normal level. You know, we are all warm blooded animals. Our atmospheric temperature may be changing accordingly due to as per the different types of climates and all. But our body temperature is always maintained. So we have that. For that, we have many systems, right from hypothalamus, nerves, all there are hormones, all blood circulation, and the sweat glands, everything, and the muscles, all these systems working together for maintaining our body temperature. So in fever, what happens is the normal this mechanism changes, and that increases our body temperature. So it's a clinical manifestation in many diseases and conditions. We often come across fever in many diseases, specific diseases and specific conditions, and various unfavorable circumstances. When body face an unfavorable circumstance, there may be fever, which may be a defense mechanism, but it often troubles the people, the family members, and as well doctors to also feel difficult to reduce the temperature in certain conditions. So the reaction of the body towards external or agents or stimuli. It is a reaction of our body towards any kind of stimuli. So causes of fever. You know, whenever there is any infection, body will produce fever. Whenever there is an inflammation, there has to be fever, because we have studied the signs of inflammation, redness, temperature rise, pain, swelling, all those we have studied. So, temperature increase, that is a characteristic feature of an inflammatory process. So, in fever, we come across that. And if there is an irritation to the tissue, that can also produce increase in temperature. And when there is an immune response and allergic response, all these things can produce an increase of temperature. And toxins, when some toxins enter our body, immediately there may be some increase in the temperature. And tissue destruction, whenever there is an injury, after injury there will be destruction of the tissues, and that damaged cells will circulate, and that will produce a fever. And in cancers, when a fever case comes, we get a case of fever, and if the fever is continued, we must suspect cancer too. Not in all cases, but there may be cancer cases. Leukemia is many times presented with just fever and ulceration and all, and the fever continues. Initially, we may not suspect cancers, but there may be. So we have to rule out. Once the fever goes out of control, we have to rule out. There are different situations that must be identified. And metabolic causes too can produce increase in temperature. So just have a look at the image. We have a thermoregulatory mechanism, thermoregulatory system we have, and using that, our body can maintain the temperature. We have peripheral nerves, and we have nerves that will check the visceral temperature. So the body can identify outside temperature as well as the internal temperature, and that information will be sent to the brain. And we have the hypothalamus that has got thermoregulatory center that works, and it has got nerve connection that will adjust sweating, muscle tremors, and all these mechanisms. Blood circulation, because it can dilate the blood vessels. When there is dilatation of blood vessel, the body temperature changes. When there is constriction, so suppose we go to Himalayas, the mountains and all, there will be vasoconstriction, so the body will maintain the temperature. It will prevent loss of temperature. So whenever there is a hot climate, our sweat glands will start working, and that sweat will absorb heat for evaporation. So our body temperature will be always maintained. But unfortunately, in fever, it changes. This mechanism alters, and that can produce problems once the fever goes out of control. Otherwise, fever is not. So we cannot say unfortunately, it's a body's defense mechanism. But once it goes out of control, then we must say it is unfortunate situation. Now, we have many people are having a wrong idea that uh, many times parents call, doctor, my child is having fever, please do something. The temperature is 101 or 100 degree, please help. Because the majority of the people are under a wrong impression that water boils at 100 degree, so when my child is having 100 degree, that's very dangerous. No, we have to educate the mother that water boils at 100 degree is Celsius scale, but the body in medicine we use the Fahrenheit scale. So nothing to worry about the temperature. This is Fahrenheit. So 98.4 is equal. We have a slide. You can just have a look at the Fahrenheit scale and Celsius scale. You can just compare. Our 98 is not much. So we have to educate the people, the mother, that nothing to worry, because in India 100 degree is a big problem, but in America they say 100 degree is just an initial state of fever. So we have to educate our patients before we start treating all fever cases blindly. Now we have different grades. So hypothermia is a condition where temperature is 95 degree Fahrenheit. This is a dangerous condition. We may face this in high altitudes and all. So we have to, because our body has got the limitations. When we expose to high altitude, we have to take several precautionary measures and all, so that our body heat will not be lost and it may go into hypothermia if we don't control it. In Siberia and all, people may often suffer from this. So we have a homeopathic remedy that can help when we travel high altitudes. As per Dr. Abdul Latif, one of our senior principal, he had made the study on that, and the remedy is mephitis. In Materia Medica, it is written that ability to go high altitudes without getting affected by the coldness. So that is given in mephitis. So he has suggested mephitis, I think 3x or 6C or lower potency, he has suggested. That can be taken as a preventive remedy whenever you go high altitude. Mephitis is normally a cough remedy for whooping cough and all, we use it. But that remedy has got another indication, like that coca. When someone goes to mountains, we can give coca because they may have high altitude sickness, breathlessness. So coca can be given. That will help wonderfully in such cases. So along with that, you can keep in your travel kit. You please include mephitis as well. So hypothermia is 95 degree Fahrenheit, and we have a subnormal temperature, that is 98. So subnormal. That means it is not um, normal temperature, but little less than that. And we have normal temperature, that is 98.4 degree Fahrenheit. That is a normal temperature. So once it goes more than 99, that is fever. I heard in America they say if it is more than 100, then only they call it as fever. But for us, it is 99 degree Fahrenheit. If it goes beyond that, it is considered as fever. And we have low grade fever, 100 to 101. So we can take the screenshot of this 100 to 101. That is low grade fever. And high grade fever is 103 to 104. This is high grade fever. And dangerous temperature is 104. Above 104 to 1 up to 107 is considered as dangerous. This is very dangerous situation. And beyond that, above 107 is hyperpyrexia. It is a medical emergency. That is possible because the brain won't be able to survive. That's why in our body, the most sensitive organ to temperature is our brain. That is the reason we suffer from febrile convulsions, because the brain gets irritated and that produces convulsions. So fever types, before we go deep into the convulsions, just many times in college we used to get confused between different terminologies: continuous fever, intermittent, remittent, all this. Very simple, nothing to get confused. Simple. In continued fever, a temperature does not fluctuate more than 1 degree during 24 hours, but at no time touches the normal. Very simple. That is, temperature is high. Our body temperature is high, there is fever, but for the 24 hours, that temperature remains. Maximum 1 degree increase or decrease possible. Otherwise, that temperature is maintained. That is called continued fever. Simple. And the second is remittent fever, when the daily fluctuation exceeds 2 degree. So here temperature is continuous, but the temperature fluctuation is 2 degree. So it may go 2 degree up or down, and that keeps fluctuating. But patient will have, and there may be different stages, and another episode of fever comes. So very simple: 3 in one, continuous fever, and in the second one, continuous fever, but fluctuation is little bit more than 2. And the third type, fever is there, but it comes to normal body temperature. Again, another episode comes. And under intermittent, we have 3 types. That is quotidian. Quotidian means paroxysms occur daily. So in the morning I have fever, then chills I may have, or sweating. This keep on changing. As per that, we can have different medicines can be selected in the as per the order of these stages. So quotidian has got the daily changes of paroxysms, but tertian has got paroxysms on alternate day. So tertian means third day. So today I won't be having fever. Next day, today I will have fever. Next day no fever. On the third day I will get fever. So this is third day fever or tertian type, and quartan is the fourth day. That means today I have fever, and for 2 days I don't have any fever. Then on fourth day I will get another. So these episodes keep on changing. Simple. Okay, fever is not our enemy. Fever is only a mechanism to create unfavorable environment to the pathogen. Simple. Our body needs temperature. In the same way, pathogens, maybe bacteria or virus, they all need adequate temperature. So fever is a method to keep them away from our body by making an unfavorable situation for their survival. So unfortunately, fever can produce problems, but within the limit, it is a blessing. So it fights infection and prevents proliferation and makes the phagocytes active. We have many phagocytes in our body. So all these phagocytes are always not working. Some phagocytes are silent. So neutrophils are there in the blood that they will be doing all the activities. But once the infection goes out of control, all the inflammatory cells, mast cells, all the phagocytes come and they start working. So it is always like a reserved police. We have the police, civil police we have, and we have reserve police, armed reserve police and military, and all these, they become active during a calamity, during a war, possibility of war. So in the same way, when the fever comes, all these hidden phagocytes become active and they be ready to attack. And it's an active defense mechanism. Fever is an active defense mechanism, and it fastens the recovery. So if there is an infection, we have studied in homeopathy, if low vitality is there, if the vital force is very weak, there may not be even temperature, there may not be any cough, there may not be any vomiting, diarrhea, everything will stop, because our body has no vitality to respond. So body resistance will be reduced. So in the same way, when there is low resistance, low vitality, almost like a carbovide patient, when we touch, we feel a carbovide patient, that coldness, cold sweat, cold breath. So in the same way, so whenever there is a defense mechanism, there has to be fever. If no fever means the resistance is very bad. And within the limit, fever is our fund. I have already covered. And fever is dangerous only when it goes high. Now, febrile convulsions can be dangerous, of course, but only a few cases of febrile convulsions are dangerous. So it is our duty to differentiate which febrile convulsion is good and which one is dangerous. That is very important. So making us panicky is a medical trick nowadays. You might have seen patients are afraid of all the complications. That is why many times they are afraid to take Ayush medicines. They are forced to take medicines that produce more side effects and all, because they are a little bit afraid, because that even bacteria or pus cells in the urine, they are forced to take the antibiotics because of the fear. So we can say that a disease is not dangerous, but the fear of disease is more dangerous. So many times people are forced to take medicines that will produce more medicinal diseases. So whenever there is an infection, people are forced to take antibiotics. And due to fear of tetanus, all are forced to take vaccines and all. And whenever there is an appendicitis, many people say appendicitis is a surgical condition. No, the initial stage of appendicitis, if you take the case properly, if you give the correct homeopathic remedy in minimum dose, it is possible to cure the patient. No need for surgery. Only thing is that we have to differentiate whether appendix condition is going in a worse condition. That we have to differentiate. For that we have to look at, there are parameters, we have to monitor all those things like WBC, pulse, and all the findings. That's very important. Otherwise appendicitis we can manage with our homeopathic medicines. And peritonitis, once peritonitis starts, it may not be easy, because 50% mortality rate is there even though peritonitis cases we hardly get nowadays, but once the peritonitis starts, it's very difficult. So before that, we can manage our medicines with the help of our medicines. And septicemia, all are afraid of septicemia. Of course, septicemia is a dangerous condition, but before that, if we can manage, we can prevent, then definitely no need for hospital admission and all. So that is why in the primary level we can do a lot. Unfortunately, we don't get an opportunity to treat such patient many times. So we hope that even in COVID we will get permission to manage COVID cases, because when we read the report that patient died because of acute respiratory distress syndrome or disseminated intravascular coagulation or multi-organ failure. So we just feel bad. Oh my God! If I had given an opportunity to treat the patient with Antimtat, Bryonia, or phosphorus as per the indication, or Nexomica, we have many medicines. So we could prevent the patient going into respiratory failure. But unfortunately, we did not get an opportunity. But we hope already many homeopaths unofficially managed using online technology. Many cases were cured, and I personally know six patients who got benefited with bryonia, and two got benefited with gelsemium, and some of my colleagues, they managed with arsenic alb, phosphorus, antimtat. Of course, we have to make a list. We are planning to make a list of cases cured so far, and that can be submitted to the health authorities, so that we'll get an opportunity to help the people who are already suffering, or who are already got infected, or those who may get infected tomorrow. Okay, so fear of any disease is more dangerous than that actual disease. Now, we have seizures. People are afraid of seizure as an epilepsy. So when a child gets febrile convulsions, immediately the family members and the people around will diagnose it as epilepsy, and they feel, oh my God, because epilepsy has got certain bad names. Traditionally we say that epilepsy is something bad that can be inherited from one generation to another. So because of that, people are a little bit afraid of this kind of situations. And diabetic coma, we often read about diabetic coma in our book. That's why once the sugar level goes high, immediately they stop our medicine and go behind other treatment, insulin and all. So fear is the biggest problem. And hemiplegia. So all hypertensive patients, because of the fear of hemiplegia, they stop our medicines and go behind all those anti hypertensive drugs, and they come with some many drug diseases. So we have to manage all these patients and make them happy, make them comfortable. Of course, we have to monitor whether they don't take proper care or not. So fear is always a big problem in medicine. Many exploit that fear. So we have to make our patients comfortable. That is the first thing. And of course, we have to manage such cases properly. Now, seizure. A seizure is a sudden uncontrolled electrical disturbance in the brain. For me to work, my brain has got sensory nerves and motor nerves. So sensory nerves will give an information to my brain, and motor nerves will give information to my muscles. So all my activities are controlled by my brain, spinal cord, both central and peripheral nervous system we have. So in convulsions, what happened is excess of electrical energy stimuli is given to the muscles. That is why unnecessary involuntary movement starts. That is what seizure is. And there are, apart from the movements, a seizure will change your behavior, because a person may sit gazing like that, vacant look or inactive look, and there may be movement, as I have already mentioned, and there may be difference in feelings. They may get some aura before or after convulsions. They have a disorientation, and levels of consciousness also will change during an episode of seizure. So seizure is not just a movement, but it has got many other things, and there may be involuntary urination or defecation and all these things can happen during a seizure. So febrile seizure. Febrile seizures are convulsions triggered by a febrile episode in the absence of other lesions that cause convulsions, such as meningitis, encephalitis, low sugar level, electrolyte imbalance, and space occupying lesions in our brain. So, a febrile convulsion takes place in the absence of all other factors that may produce convulsion. So meningitis, often we encounter meningitis, encephalitis, low sugar. So when you get a person who has got convulsions, don't directly jump into a conclusion that he has got some meningitis or encephalitis. Normally, when there is an electrolyte imbalance or a low sugar level, they may behave very abnormally. I know one old woman who was diagnosed as some madness by the family members, and her all the investigations done, and it was found that it was sodium. There was hyponatremia. That's why she got all the problems and behaving like a mad person. But it was not due to any mental disease. So many times we miss electrolyte imbalance and sugar level. So please remember, when you visit a bedridden patient who is almost having a partially coma or a disorientation or even coma, you have to do all the investigations. So measure blood sugar level, sodium and potassium and bicarbonate levels, and of course all the urea, creatinine level, all those things, and ammonia levels, because ammonia level can also produce increase of ammonia can also produce convulsion. So all these things must be ruled out. And of course, the most important, our topic is febrile convulsion, so we will cover only that. So the basic feature of febrile convulsion is 50% common in children between 6 months to 5 years. So just imagine, for 6 months normally they are free. Maybe the mother, support from the mother, the feeding and all the nutrients, and we have immunoglobulins from the mother, and all these things can help. So after 6 months they start suffering. So 6 months to 5 years. So before the child, at the time when the child goes to school, this is the common age group affected by febrile convulsions. Normally after that we don't get febrile convulsions, but if we get it repeatedly, then we have to rule out. If there is epilepsy and all, we have to refer the case for EEG and all investigations like MRI and all. Okay. Now, 3 or 4 out of every 100 children may get it. So febrile convulsion is very common nowadays. And when the fever goes above 104 degree, there may be a convulsion. But I have seen febrile convulsion just before 100 degree, even before 100 degree. Sometimes they may get once it goes 102, 103. It depends upon the individual. It may change, but most of the time it is 100.4 degree Fahrenheit. And seizure looks serious. Many times, just looking at them getting convulsions like this, family members feel worried, especially when they get for the first time. Just imagine our child gets convulsions for the first time. That is a painful situation for the family. All will get, they know they cannot, because they are not sure what, because of whether it is due to fever or due to some other complication. Normally, people will think about some tumor in the brain. That is the first overdiagnosis the common people make when there is convulsion. So we have to, and of course, the epilepsy, the taboo of epilepsy remains within our mind. That will produce more worry, agony among the family members. And usually harmless except in complex type. So complex type of febrile convulsions are harmful, but majority of the situation it is simple febrile seizure that is not dangerous at all. And febrile convulsions usually last for only a few minutes. So if it is prolonged, when it is repeated, then we have to worry. So what causes seizures? You know, whenever there is an inflammation, whenever there is a fever, there will be high cytokines level. So that trigger convulsions, because that will stimulate the brain and that produces convulsion. Because that means any inflammatory modulators in the brain, in the blood, when it increases, that can stimulate convulsions. And developing brain of a child reacts high to temperature. We have studied in organon that a child is having high susceptibility. So in the same way, a developing child's brain is very much sensitive to the temperature. That's why they suffer compared to the other adults. And just the third one is more important. Low serum calcium, sugar, and sodium favors conversion. That means if you get a child having tendency to convulsions, history of febrile convulsion, you must always tell the mother to maintain good nutrition. That is very important. So blood sugar should not come down. If it comes down, the child may get convulsion. So the calcium level and sodium level also very important. So you must ask the mother to give some healthy food that will supply sugar and calcium and electrolytes. Especially the gruel is the best food that will give sugar and electrolytes. Gruel is a Indian country meal we eat, and we can give coconut water like that. Healthy substitute food drinks and all can be given, and ask the mother to get regularly. That can be done regularly. Ask them to get exposure to sunlight so that they get vitamin level, and that will maintain the calcium level in our body. Nowadays what happens, people don't give food when there is fever. The child may have low appetite. That's a mechanism because we cannot digest a heavy meal during fever. So we have to give a meal that is easily digestible and that can easily supply all the vitamins, all the nutrients, macro and micronutrients to our body. That is very important. But avoid a heavy meal that will be a burden for the body, because digestion will be very difficult if we give a heavy meal, because when the body is already fighting an infection. So that is the most important thing. And another is depending upon the environmental factors, family history, and previous history. This is very important. If there is family history, if there is previous history of febrile convulsions, there is possibility. So when we get such children, the mother will tell that, doctor, we have a diazepam, we have all those anti-convulsive medicines, can we give it? So we have to decide whether to say yes or no. If we are confident that our medicines can prevent it, we can definitely say no. Otherwise, we have to ask them to continue, because many times, especially those who have recurrent tendency to convulsions, and sometimes it may become complex seizures, we cannot suddenly say, oh, don't take all those medicines. So it depends upon the case. The case only decides our approach. And febrile convulsions are common in short febrile illness, eruptive fevers. So measles is very important, and German measles. In both, there may be chance for convulsions, and otitis media, and upper respiratory, any upper respiratory infection like streptococcal infection or staphylococcus infection, the pharyngitis and all, it can produce, and tonsillitis and rotaviral infections. Rotavirus produces diarrhea. Along with that, there may be fever, uh, influenza, and UTI, urinary tract infection. All these infections can produce febrile convulsions. But most common among children is some upper respiratory infection that produces convulsions. Still, it can come in even in otitis media if it is an acute. Okay. Now, signs and symptoms. Febrile convulsions comes with a fever. So fever has to be there. And when we check temperature, it is usually above 100.4 degree Fahrenheit. And they look strange. Suppose the child is in the class or within the house with the family members, they look strange, unresponsive. They may not respond for a few moments and then become still and then stiffen, and muscles twitching starts, and roll his eyes. It may go up or it may go down, and then start the tonic clonic seizures like this muscular spasm. It may be generalized or focal. In generalized, all body is affected, whereas in focal, only one area is affected. And some only get staring, they just stare like this and they get. So many times family members may not diagnose it because they say that child is looking like this, they have some fear or something like that, but it is our duty to identify whether it is convulsion or not. And some of them are even vomiting or become breathless, because during convulsion, it's the muscular movement starts, spasm starts. So vomiting is a spasm of the muscles, stomach muscles constrict, and that can produce vomiting. And there may be constriction of the respiratory pipes, and that can produce breathlessness. And among these, the most dangerous is vomiting, because that may produce aspiration. So we have to take some precautions when we see a person having a febrile convulsion, that we will discuss. And there may be loss of consciousness, and there may be involuntary urination. Normally in epilepsy there may be even involuntary defecation as well, but usually in febrile convulsions, not in all cases, but a few cases, you may get involuntary urination. And after the seizure, the child quickly returns to a normal state. In febrile convulsions, uh, seizures usually last less than 1 minute, maximum 5 minutes, not beyond that. And some feel sleepy after the episode. That is very common. They feel little tired, so we have to ask them to take rest. Otherwise, some of them, majority of them, can move around like normal children. So, types of febrile seizures. We have simple febrile seizure and complex febrile seizure. Simple is simple, as the term says, it is simple, and the complex has got many complexities. So, simple febrile seizure is the most common. Thankfully, this is the most common one, and generalized tonic-clonic seizure happens in simple. So, please remember, if a child is having convulsion and the whole body is affected, the limbs, extremities, upper and lower extremities, the head, face, all the muscles are affected, that means it is generalized. That means nothing to worry about. That is simple febrile seizure. And it lasts only a few minutes, never go beyond 5 to 10 minutes. So if it is continuous, it may be complex febrile seizure, and it resolves spontaneously and no recurrence within 24 hours. So when the mother is bringing the child, we have to ask how many episodes of convulsions in a day. So if it is more than one or two or three, then we have to take precautions. And complex febrile seizures, as the name indicates, from complex febrile seizures, focal seizures come in complex. That means only one part is affected. One hand, right hand, left hand. We have medicines like Helleborus, Bryonia, and all. One area is affected. That can be considered during such episodes. And it lasts more than 10 minutes. So it continuously, the convulsions will be continuous. And 2 to 3 episodes within 24 hours. That is very important. So if it is 3 episodes or 4 episodes in a day, we have to take the help of a neurologist to rule out any other lesion that is producing the convulsions. And no fully recovery after 1 hour. It is called Toad's paralysis. Almost like a toad. You might have seen toads on the pond and all, on the sides of the gap grooves and all. They just keep inactive for hours or days. They don't even move. In the same way, the affected person will have Toad's paralysis. In the sense, it is not muscular paralysis, but the movements will be less and the person becomes inactive after the episode. And many times, anticonvulsants medicines will have to be prescribed because of the continuous seizure. Because continuous convulsion means it is dangerous. It can damage the brain. And need to rule out other causes. I have already mentioned encephalitis, meningitis, or some space occupying lesion. All these things must be ruled out. And hospitalization is needed in many cases, because once the convulsions are continuous, we have to take the help. Of course, we can prescribe our medicine that can be taken along with that, but we need a feedback from a neurologist and some investigations and EEG, MRI, everything needed, so that we can decide whether to give a medicine or to hand over the case to a modern medical systems, and later on we can take the case and manage the case with a constitutional remedy, so that this tendency can be eradicated. Now, care is needed in complex febrile seizures compared to simple febrile seizures. So questions we must ask when we get a case of febrile seizure: about the fever, origin, duration, and progress. So when it started, how it started, when it started, and what is the present situation, and since how many hours you have this problem, all the things. And history of convulsions or family history of convulsions, that is very important. And how long the seizure started. Many times the mother may not be able to tell because the child was in the school. So we have to take the help of a teacher so that we get the clear picture. And what happened step by step, how it happened. Because sometimes we can easily diagnose the remedy as well. Because mother was scolding the child, immediately child became unconscious and got the seizure. So we can think about a remedy like moscas and all, because moscas, when you scold someone, immediately they become like panic attack. Someone after a fight with the husband and wife, and then one partner becomes unconscious. There may be breathlessness. So like all the panic attack, we get it. So we have medicines like aconite, moscas. Moscas is the most useful remedy for that. Of course, ignatia can be given. And step by step information is very important in seizure, and whether recovery happened within 1 hour or not, that is very important. And number of episodes in a day, that is also important. And any other causes like injury, eruptive fever, drug intake, all these things are very important, because many times family members may hide some reason. Now today only I got a report in Kerala. One baby aged sorry I think just 55 days old baby is brought to a hospital, and there was a huge hematoma, and the doctor asked how it happened. They said that the baby had fallen down from the bed, but later on they had to take the help of police, and police came and asked the family members, and finally they had to disclose that father had beaten the child because he has some suspicious or paranoid schizophrenia like condition, and that's why uh, child got injured and almost in a terminally ill situation. So history is very important. Many times they don't tell the reason, and we will be made fool because we don't know the actual how it happened, and we keep on treating without knowing the fact. So communication with the family members, communicate rapport with the family members, very important. And when we feel something suspicious, better refer such cases. Even we allow to take the help of in the police and all many times. So all these things are very important. And any other causes we must rule out, or a history of any intake of chemicals, either accidental. Children by curiosity they may take some chemicals that will produce all the problems. Or you have to even look at the extremities for any bite marks. I remember one of my patient, she was found unconscious on the floor, and her family member took her to the hospital. They did all the investigations, but nothing found. At the end, they found a bite mark of snake on the foot, and they did all the protocols. They have a series of tests, and it was diagnosed as snake bite case. So we don't know the actual picture. So such information, even the examination of the body is very important, so that we get actual cause behind uh, as, difficult situation like unconsciousness, fits, convulsions, and all. Yeah, just have a look. The first one is partial seizure. Just have a look at the EEG. You can see spikes only at one area. That means only a small part of the brain is affected. Other areas are not affected. That means there has to be some pathology only in that area. That is why, when we do electroencephalography, the electrodes are kept in different locations, and we get the information, the spike electrical signal from the whole area of the brain. And once the brain is producing electrical activity only in one area, that may be partial seizure. So only that muscles, those muscles controlled by that area is affected in partial seizures. So that is more dangerous because there has to be some pathology in that area. Whereas in generalized seizure, you can just see the right side image. The whole area is affected. You can see the spikes everywhere. In all the EEG graph, you can see the convulsions. That means it is generalized seizure, febrile seizure. That means less dangerous compared to the uh, febrile, partial febrile seizure. Now, questions normally we face from the parents: why my child is getting this, and is it dangerous? What to do during the attack? What are the dangerous signs? Can I stop the fits medicine? These are the 5 to 6 questions we face in our day-to-day practice. So we have to diagnose the case. We have to give the proper advice. We cannot blindly say that don't take any anticonvulsive medicine. That we cannot. We need to look at the case, look at the pathology, look at the situation, then we have to suggest. So every case we have to decide as per the case. Now there are some truths on convulsions, except on rare cases, looks scary but harmless to the child. So, simple febrile seizures, even though it looks scary, but it is harmless to the child. So, we have to convince the family and do not cause brain damage. So, we have to educate the mother that it will not damage the brain, except in certain conditions when it is prolonged, and do not cause deaths. Even if the child may become unconscious due to convulsion, it won't produce death, and only a slight increased risk of developing epilepsy in the future. It's only a minimum percentage. Otherwise, there is no recurrence in the future. The majority of the children, they say that, or the mother will say that child had febrile convulsions, but so far no repeated episodes of convulsion. That means it's very rare. So what to do during seizure? That's very important. We have to stay calm. Simple seizure is not dangerous. So only thing is that gently place the child on the floor. If there is convulsion, let them be on the floor or the bed, relaxed, so that they won't hit some sharp objects. So remove all the nearby sharp objects and place on the side to prevent choking. That is called a recovery position. So during convulsion, if the child cannot be managed, don't touch. Let them complete the episode. After that, you can turn the child to the side and keep in a recovery position. That will prevent aspiration. Even when an adult gets these convulsions, recovery position is very important. Because even in cardiac arrest, suppose you give CPR to a person who has got cardiac problem, and you could revive the cardiac activity by the CPR, and you are taking him to a hospital. So you can ask the family members to keep him in recovery position, and that will prevent aspiration pneumonia. You know, aspiration pneumonia is a very dangerous condition in the ICU. Many times antibiotics don't work and the case will fail. So we have to prevent aspiration pneumonia by keeping the victim in recovery position. That's very important. And loose the clothes around neck and head or the chest. Tight clothing can be loosened so that they can easily breathe, they can easily move and communicate later on. And watch for blue discoloration of the face. So cyanosis is very important. If there is bluish discoloration of the tongue, face, and tongue and all the skin, it can appear anywhere. Peripheral cyanosis, we have central cyanosis. So we have to look for the cyanosis. If cyanosis is there, it is dangerous. So even in gagging, once it is complete choking, there is chance for cyanosis. So we have to differentiate whether it is choking or due to some other problem, spasm. Even in chemical poisoning, there is chance for cyanosis. So we have to differentiate. We have to ask the history in detail. And note the duration of seizure and type of seizure, and observe the victim for 6 hours. Even after the convulsion, the child is active, but ask the family member to observe the child for another 6 hours. Don't allow them to go for cycling, don't allow them to climb the trees and all. These are very dangerous. Swimming is very dangerous. So we have to ask them at least for 6 hours, observe the child. This is the image of recovery position. Just have a look. You can go to YouTube, and see how to keep a person in a recovery position. So an unconscious patient, we brought him back to normal state, and then we have to keep him in recovery position. So keep one hand right like this and another hand like this, and we have to lift one leg. Just have a look at the image, and then we have to turn him to the side, And the fourth one is the recovery position, and in that position the body fluids, all the mucus or even the fluids, sometimes even the erectations, the contents of the stomach may come up and obstruct. So all these things can be removed automatically, it will come down, so that person can continue breathing. And even in cardiac heart attack cases, second heart attack may not happen if we keep this person in this position and take him to the hospital. What should not be done? This is very important. Do not restrain the child. Many times, people, due to lack of knowledge, they keep the muscles and all tightened, and that will produce the. It can be even dangerous. Don't keep them like that, because the muscles are forcefully moving, and when we hold it, it can produce pain as well. Later on, they may have pains and all. So let them move freely. Only thing, keep the sharp objects. And just imagine, you see someone biting the tongue. Many times people, what they do, they just insert the finger, and a person who has having convulsions may bite horribly, and that may damage our finger. And don't even keep some objects like pencil and all to prevent the tongue getting bitten. That may damage the teeth, and that is very expensive. Fracture of a dental fracture is very expensive compared to a suture of the tongue. So let the tongue injury continue, no problem. Later on, it can be sutured. But a fractured teeth has to be managed by a huge expensive amount of periodic treatment has to be given. So better don't interfere like that, and avoid holding them tightly, and don't give anything. Don't put anything to the mouth. No water, no soda water. Many times in a local village area, when someone gets convulsions, immediately people get soda water and put it. Never do that. Of course, even tablets should not be given. Suppose a child is having convulsion history, and child gets convulsion, and the mother gives the tablet. No, never. It may go into the wrong way and kill the child. So don't do that. But inhalation is okay, tolerable. So we are lucky that in homeopathy we have medicines that can be administered with the help of a cotton. You just put a few drops of the medicine and apply. So that can be given. Even on the skin we can apply. Otherwise, no medicines, not tonics should be given during the convulsion. After the convulsion, we can give it. But we have to make sure that he is in a position to swallow. Now, always look for, if seizures last for more than 10 minutes and recur, we have to rule out serious condition. And if breathing difficulty, I have already mentioned, we have to rule out some obstructions. And if no breathing, then we have to help with the victim by CPR. And we have to look for any signs of dehydration, dryness of the mouth, lips, sunken eyes, tearless cry. This is very important when a child is having dehydration or not. The child will cry but no tears. That means dehydration is there. And sunken fontanelles. Now we have to always look for meningeal signs like neck stiffness, Kernick signs. We have to look for, so that there is possibility of meningitis, and that can be. You might have seen one child of a doctor who had convulsions recently when the child got infected with COVID. The first thing was convulsion. So they were suspecting some meningitis. There was neck stiffness, and later on it was proved that there is COVID, and the child could not die, could not survive, unfortunately. Okay. Now, differential diagnosis of febrile convulsions. We have to look for rigor. Rigor is very common. When there is chills, we may get rigor, but that is not convulsion. And delirium. When the fever goes high, there may be different types of behaviors, sensitivity, motor and sensitive abnormalities as we get in delirium. And breath holding spells. This which get in some children. When they get irritated, they cry. And once they cry, they will have breath holding, because the epiglottis is a valve that will prevent food entering into the respiratory tract. So once the epiglottis move, it gets obstructed. It won't move. So the victim cannot breathe, and that may produce cyanosis. Not in all cases, but in some cases it may produce cyanosis. So this is called breath holding spells. Because of this habit, The parents will never entertain the child to cry. Whatever the child asks, they will give immediately, because once the child cries, they may get breath holding spells. And these children are going to be very naughty, because they know if I cry, I will get, because I don't want, my parents won't allow me to cry. So they will become very naughty children. So for that we have a medicine. Belladonna is the best remedy for breath holding spells. Another remedy is laurocerasus. These two remedies can be considered in such cases, breath holding spells. Now another is epilepsy. You know, seizure and epilepsy are both different things, not same. Seizure is just abnormal movement of the brain, and epilepsy is a disease that has got seizures. So we have to differentiate. So for diagnosing a case as epilepsy, we have to take the help of a neurologist. He will do electroencephalography and MRI, all the investigations. Then he will diagnose it. And fever syncope, when there is fever, immediately unconsciousness, but that lasts for a few minutes. That is called fever syncope. Just like when you scold someone, they become unconscious and they get up. Now reflex anoxic seizures. Anoxia means lack of oxygen. So reflex, when there is less oxygen, the body will produce reflex anoxia. So a person may become unconscious, he may fall, he may get convulsions too. Nowadays there is more chance, because all are using mask, tight mask that won't allow breathing, and they may have anoxia. So when you do heavy exercise, don't use mask. Preferably do exercise in your house, so that you need not use mask, because breathing is a big problem. I feel the single layer mask is better, because breathing is possible, because the hard triple layer mask and all, it gets obstructed. Of course, we doctors are supposed to use N95, because no other way. Now we have to look for other brain lesions like bleeding, meningitis, encephalitis, brain abscess, tumor, etc. When someone gets convulsions due to some lesion in the brain, many times first CT scan is done, then they do MRI. So suppose you get a patient having head injury and possibility of bleeding in the brain, or some injury to the brain. First they do CT scan, then they do MRI. Why? Because many people blame the doctors that they simply did CT scan, again they did expensive MRI. Instead of doing CT, they could directly do MRI. This is the common complaint made by the general public about doctors. What do you feel? This is not a mistake of a doctor, because when there is injury, head injury, the first thing to be suspected is bleeding. So to diagnose bleeding, CT scan is the best. CT scan will see that can locate subdural hematoma, subarachnoid hemorrhage and all. Once there is no bleeding, that means there may be some other lesion like infarction. So we have to do an MRI that will give better information. Then angiography may be needed. So first CT scan to rule out bleeding. So never allow the public to blame doctors. Many times they blame the surgeon that he did all the unnecessary investigation. So we have to educate the people. Now, investigations. No need of investigation in simple febrile seizure. You can tell them, no need to worry, this is simple seizure, no need of investigation. But in some cases, we have to do. Some of the family members may be worried too much, so we have to do blood investigation, routine urine, and we have to test the blood sugar, serum creatinine, bilirubin level. Bilirubin is also very important in children. Electrolyte changes and ammonia, serum ammonia levels. And if the seizures are continuous, you have to look EEG, electroencephalography, and lumbar puncture is needed only when there is recurrence and prolonged convulsions. Same with EEG. And then CT and MRI, only when there is recurrence and prolonged convulsions. Both investigations needed. Abuse of convulsive drugs. You know, many children who had febrile convulsions are forced to take anticonvulsion drugs having side effects. So we know that only a small percent of children are having complex seizures during fever. Others are not supposed to take anticonvulsant medicine. These anticonvulsant medicines are even taken as a preventive medicine, not needed in majority of cases. These are the areas where modern homeopathy can help. And of course, if the convulsions are complex and repeated, troublesome, then we can allow them to take the modern medical drugs. So these are the area where homeopathy and modern medicine can work together for helping the people. And our constitutional remedy can prevent further attack. So gradually the anti-convulsion medicines can be tapered and they will be all right. Now, the best option is homeopathy, which is safe, effective, and free from side effects. So, points to be noted in fever when you manage a case with homeopathy. 1. Mental and emotional changes associated with. This is very important. Recent changes during the fever. That is very important. The mental and behavioral changes. Don't look at the basic characteristic of a person. That is not useless. You have to look for acute sectoral totality when you manage a case of febrile convulsions. And after that, once you start the constitutional remedy, you can think about the basic characteristic, all the past histories and all. Now look for causation, location, sensation, modalities, concomitants, and PQRS that may be within, that may come within any causation. Even we get causation as a PQRS, location, sensation, modalities, and concomitant. So we have to look for the prominent indication. See, all individuals may not have prominent causation, all may not have prominent sensation, modalities, concomitants. So it depends upon the individual. So we have to consider the prominent things. Many times beginners do a mistake. They take everything told by the patient and enter into the repertory chart, and they get all the commonly proved, well proved remedies like arsenic, nexomica, sulfur, lacasis, and all. So we have to look at the prominent symptoms as per the case and look at the appetite, thirst, desires, aversions, bowels, urine, etc. during the episode. And we have to look for the thermal modalities, need for covering, fanning, because we don't know which indication will give a hint for us to make an easy prescription. We don't know. Sometimes we get only 1 or 2 points. A person having fever, he talks only about his business, nothing else. You can think of a remedy like bryonia. So we don't know which hint is going to help us. So we have to look at all the possibilities for an easy prescription. And different stages of fever. Sometimes we get a chance to prescribe as per the stages: heat, chills, and perspiration. Even the location of perspiration is very important. Type of sweat is important: cold sweat, hot sweat, all these things. Because a remedy like carbovage and opium can be easily differentiated by cold sweat and hot sweat. If the sweat is cold, carbovage. If it sweat is hot, we can think of opium. And sleep and dreams, if it is significant, then only you can consider it. And clinical examination, pulse is very important, tongue is very important. You know, when you don't get any remedy or you get confused between a few remedies, you just have a look at the tongue and the tongue will tell you the correct remedy. Many times I have experienced this. Many times patients won't tell, their tongue will never tell, but you just have a look, the tongue will tell the correct remedy. At least a differential remedial diagnosis is possible with tongue diagnosis, looking at the tongue, I mean. And face, color, odors. Sometimes odor will help us. For example, when you enter into the room of an arsenic person, you can easily differentiate, because that smell of acid, that putrid smell you get in the room of an arsenic person. Even though he is very neat, he is fastidious, but his body has got that putrid smell. Just like a mirth soul person. A mirth soul patient, suppose they come and sit in front of us, the moment they start talking, the moment they open the mouth, you get the smell of mirth soul. So like that, we have to look for all these things that will help us for successful prescription. And of course, lab investigations are very important. If you go to repertory, even Ken's repertory has got many rubrics that can be diagnosed only with the help of lab investigation. So everything is important in homeopathy. Many people say that in homeopathy, lab tests are not important, stethoscope is not important. No. If you go to repertory, there are rubrics that can be selected only with the help of a stethoscope. the breathing sound, respiratory sound, all those things in a different language they have written in the repertory. And of course we have modern repertory. I hope that in the future we will have more repertories that will give uh, valuable rubrics that can be easily converted in the present scenario, because we have many diagnostic terms, diagnostic situations that can be included in the future repertories. Now, history and words of the bystander are very important. Sometimes the patient may not give any history, anything, any information, but the bystander will tell the details. But we cannot prescribe only by looking at the information from the bystander. So many times in our government setup, they bring the patient, they don't bring the patient, father will come, and father will tell that, doctor, my son is having fever, vomiting, cough. You please give the remedy. If you include fever, vomiting, and cough in the repertory, you will get 200 or 300 remedies. So selecting a final remedy may not be easy. So many times we are forced to prescribe a so-called climatic remedy, because we have Bryonia season, Rustock season, Dulcamara season, like that. But many times it may not help. So ask the family member to bring the child so that we can look at the case and diagnose. That is better than just guessing a remedy and spoiling our reputation. Now, when the fever is a reason for convulsions, it can be prevented by reducing the body temperature by an acute remedy. Very simple. Why the child is getting fever means getting convulsion is because of temperature. So bring down the temperature, there won't be any convulsion. That is simple. We can do it with the help of an acute remedy and as per the indication, or we also have some specific remedies that can be used when we don't have any other investigation, any other prescribing medicines, prescribing totality. So we have to prescribe all those as per the case only we have to decide. And the tendency for febrile convulsions that can be managed by a constitutional remedy. So that is the final destination of a homeopath. So we have to manage recurrence. We have to cut the progress of the disease, because that may come in another way. So we have to manage that with a constitutional remedy. So if you look at the Patak's repertory, Patak repertory must be there on the table, because that makes our practice very easy. Even the rubric selection is very easy because it's an alphabetical repertory. You need not know the repertorial language. A to Z it is given. So under Patak repertory, these are the remedies given. Convulsions, fever during, arsenic, belladonna, camphor, carbovate, cinna, hyoscyamus, nux vomica, opium, sepia, stramonium, and veratrum album. Now in complete repertory, Roger's complete repertory, there are a few more remedies given. Patak has got only a few remedies because he has written only those remedies having strong affinity, and those indications were repeatedly verified in his practice. Now Robin Murphy's medical repertory, convulsions, fever during, a few more remedies: arsenic, belladonna, camphor, carbovate, causticum, cicuta, cinna, curare, ferranphos, hyoscyamus, ignatia, natramur, nux vomica, opium, sepia, stramonium, veratrum. Of course, these are the few remedies given in the repertory. It does not mean that only these remedies can be given. No, any other homeopathic remedy can be given that can be indicated in a patient in a particular case. So commonly used drugs in acute fevers. These are the commonly used remedies. Aconite. Aconite patient, how they come. They get a sudden onset of fever immediately after an acute, after an episode of exposure. They get the infection, they come and we prescribe aconite. Nowadays, many people, aconite patients rarely get, because once they get it, they take some home remedy or they go for consultation, and later on they come with some other complications. Now another is belladonna. Just like aconite, belladonna has got the sudden onset and all the features of belladonna: redness, throbbing. We will discuss remedies one by one. And we have bryonia, which is often prescribed. Now the COVID case, There are many bryonia cases. Even got result with bryonia in COVID, many COVID positive cases. And of course, we have a restox, which is a season. Right now, we have a restox season and Eupatorium puff. So right now we have many dengue cases because most of the dengue cases pain is very common, bony pain. So Eupatorium indications we often get, and the result is also positive in the it was positive in the last previous year's episodes. And we have gelsemium. So gelsemium case, the dullness and all the features of gelsemium. Euphrasia cases. Nowadays we get viral conjunctivitis too. How to differentiate viral conjunctivitis with bacterial conjunctivitis? In viral, there will be fever with conjunctivitis. So euphrasia often indicated. Even in measles, euphrasia is often indicated. And of course, ferrum phos, which is a fever remedy, a biochemic form or in homeopathic form, we can give fever remedy. That is for the primary stage of fever, ferrum phos is indicated. And for the secondary stage of fever, we have calimur. So in the secondary stage, there may be coated tongue, there may be eustachian catarrh, all the mucus become thick and all. You can think of a remedy called Kali muriaticum. And we have Nexomica cases often indicated. I think Dr. Richard Pitt has suggested Nexomica as a preventive and curative for the COVID, as per
Correct.
the basic characteristic of the epidemic, the pandemic, I mean. Now, Bacteria. Bacteria, we have typhoid-like features, but in other fever also, Bacteria is often used. Some doctors I know, they use Bacteria in mother tincture form that will reduce the temperature. I remember when I started my practice, I used to give Bacteria mother tincture because I was not confident enough to manage fever cases with an indicated remedy. Even after giving an indicated potency, I was not much comfortable, so I used to give Baptisia mother tincture 10 drops 4 times a day. But later on, once I developed confidence, I stopped using it. And we have arsenic alb and we have veratrum virit. Veratrum virit, even mother tincture is used to reduce temperature. And we have sulfur. Sulfur fever cases, redness of the orifice is very characteristic. The lips become red, even the anus become red. So many times we don't get any other indications. Mother will tell that there is redness of lips or anus. The sulfur will really help. And another indication usually we get from the mother about sulfur is when the child is having coughing or crying, involuntary stools come. That is characteristic of sulfur. It really helps in our practice. And we have China where all the vital fluids lost and fever is an intermittent type in China. We can think of China with a flatulence. So we have many flatulence remedies like Calica, Carbovich and China. And we have Natrum muriaticum, fever. Normally there may be fever blisters around the mouth in Natrum mur. Also in bryonia, fever blisters come. And Natrum mur may have a headache, all the characteristic of Natrum mur. And we have Apis. Apis has got inflammatory fever or even due to some anaphylactic conditions. Apis symptomatology we get in fever cases and all the stinging and burning and all the features of Apis. And pyrogen. This can be prescribed on the basis of indications and it can be also prescribed as a nosode. When you don't get any result with the indicated remedy, you can prescribe pyrogen. And Dulcamara is a season. Dulcamara, there will be all the discharges are profuse in Dulcamara. So it's a seasonal remedy. So we don't get patients, only father comes. Either we can give bryonia, belladonna, restox or Dulcamara. We just differentiate how the fever started. It started before 4 days, gradual onset, then we think of bryonia. If it started suddenly, then we think of belladonna. If it started after getting wet and child is playing outside freely, then we can think of restox. If in bryonia, the child will be taking rest because cannot work because aggravation by movement is there in bryonia. So available indications many times you have to look for. Now we have arnica. Arnica child may have fever, putridity is there, and there may be no needs at all. They don't want anything, they don't want food, no medicine, just like Helleborus and opium. Arnica has got no needs. Normally, when I get children having fever, the mother complains means that child is having heat of the head, rest of the areas coldness, only the head is hot. I mean, arnica is an indication. Arnica really helps for such conditions. Sometimes calcarea carp, the mother will tell that my child always wants me during a sickness. Otherwise, he is happy or she is happy. But when they are sick, they always need me. The care of the mother is needed. Calcarea carp you can consider under such situations. So look for prescribing indications that may not be prominent. We have to look. We have to ask questions sometimes. Sometimes we have to give different choices rather than giving one word. You can give whether this is like this or like that. So finally, they will give the correct indication. Now, tincture and lower dilutions that can help you reduce the fever. I have already told increase of temperature is the reason for convulsion. So reduce the temperature, there won't be any convulsion. And this is better than giving acetaminophen, also commonly called as paracetamol, to reduce the temperature. But the better option is whatever resources we have in our homeopathic system. So we have Bacchia mother tincture, we have Ocimum sanctum mother tincture, and we have Eupatorium puff. We have eucalyptus. You know, eucalyptus is a very nice remedy for influenza, cough, fever. If you read the drug picture, the materia medica in boric, you will get all the points. And we have a millifolium. You know, millifolium I often try whenever there is fever during menses. It really helps because millifolium is a remedy for bleeding. It will prevent bleeding as well. And fever, when the fever goes out of control, millifolium is indicated. If you read boric's book is a really a practical book. It must be there on the table of every homeopath, because that book will help us in our practice. So millifolium has given in Borix Metria Medica, and Veratrum verit mother tincture, because in Veratrum verit we get belladonna like throbbing and all, pulsation of blood vessels and all in Veratrum verit. And Desmodium is another Indian remedy for the fever. And Belladonna 3x. You know, we had a senior doctor, Dr. M.K. Jairam. Jairam sir always used to suggest, when you cannot manage a fever, it goes out of control, you just close your eyes and simply prescribe Belladonna 3x. That can be repeated every half an hour so that fever comes down. It is always used to say it is a homeopathy, paracetamol. So this is the remedy Belladonna 3x. And another is Bryonia 3x. When there is fever with cough, you can think of this remedy when it goes out of control, Bryonia 3x, provided you don't get any result with the indicated remedy you have given. I don't want to say that, I don't mean that you must prescribe all these remedies, but you can consider the most suitable one when you don't get the result from the indicated remedy. That's all. Now, brief indications of those remedies. Arsenic. Arsenic has got high temperature and paroxysms incomplete with marked exhaustion. So the weakness of arsenic is very characteristic. They are very tired, weak. They are not in a position to, even though they are mentally restless, they cannot move at all. Just opposite is restox. So there is great heat even at 3 a.m. and thirst for sips of water and putrid odor. Putrid odor is very characteristic, and sips of water. You just give water, they will just take little and give it back. But they need it often. So arsenic is the remedy. Because in acute case, especially in bedside prescribing, you don't have enough time to take the case for a case discussion, detailed repertorization, cross repertorization and all. We don't have enough time for that. So we have to look at the presenting totality, the sectoral totality. Now we have belladonna. You know, belladonna fever, when a child gets belladonna, I will show you how the child will be brought to you. The child will have high temperature, redness of face and all, and child will have moaning with the fever. Uh, uh, like that. If it is there, you can directly give belladonna. Morning with fever. High fever state with no thirst, feels icy cold, and violent and sudden onset. Just like aconite, there is violent and sudden onset, and morning with fever and there is redness and delirium. They may be talking irrelevant things, and they may have fear of ghosts, lot of things which started after the fever. You can give belladonna. Even belladonna can be given in 3x potency if you don't get result with the higher potencies. And next is eupatorium. You know, in eupatorium we get chills, thirst, and great pains, the bony pains, and bitter vomiting. Chills ends with bitter vomiting. So bilious vomiting we get. You can think of eupatorium perfoliatum. So patients will tell us, I have chills, bony pains, headache, and vomiting, and that bitter vomiting, that is eupatorium perf. Now we have Ferramphos. I have already told it's the first stage of fever of any catarrhal or inflammatory fever. You can think of Ferramphos. And bryonia, slow onset. So bryonia patient will come to you and tell that, doctor, I had gone for a wedding 3 days back. The next day I got slight irritation, but I was okay. I could go to my office. But since yesterday night I have slight headache, I have to go to my office tomorrow. So please give me something. I feel very tired. I cannot even move. But I need medicine because I have to go to my office tomorrow. So I have to prescribe a remedy. This is the common complaint given by the bryonia. Because bryonia will always talk about their business. I have to go, I have to do, I have to keep my shop open. So give me a remedy. And they are very weak, tiredness, all these things you get in bryonia. The gradual onset is very important. And gelsemium, gelsemium, that dullness, they have a dropping eyelids, they will come like this, their face is like this, and doctor, I'm not feeling well, I have dullness, heaviness, all the characteristic of gelsemium we get. And they are very thirstless and wants to be held, because during fever they always hold somebody, or the mother, or they want the mother to hold them, that is gelsemium. So we have to differentiate calcarea carb and gelsemium under such situations. And the gelsemium is thirstless, and there is characteristic of drooping of eyelids we get in gelsemium. Now pyrogen, I have already told, pyrogen can be prescribed as a nosode, and it can also be prescribed as an indicated homeopathic remedy. So usually in septic fever there is great heat and sweating, profuse sweating, but sweating does not cause a fall in temperature in pyrogen. So normally sweating don't give any relief, and pulse out of proportion to temperature. This is characteristic. So many times in urinary tract infection we get better result with pyrogen. Once the infection goes out of control, fever, chill, rigors and all, we can think of pyrogen. A few doses of pyrogen 200 will always help. So for never disappointed this pyrogen has, especially in fever, especially urinary tract infections and all. Now restox, restox has got a physical restlessness though, so they will just come to our clinic, they just run, so they will show their activities, they will be very alert during the fever. And chilliness is very well marked, and there may be exposure to wet weather or history of physical exertion. Sometimes after a heavy physical work they may come with fever. And tongue is red tipped. This is very helpful in prescribing restox. Ask them to protrude the tongue, the tip of the tongue, only that becomes red. You can easily prescribe restox on that. And another characteristic of restox we often get, the moment they open eyes, lacrimation. This is very strong indication in fever for restox cases. Of course, febrile vesicles around the mouth, just like natrum mur, bryonia, restox. These are the three remedies for fever blisters around the mouth. So restox often helps in our practice. Now another is Cali muriaticum. This is for secondary stage of fever, and tongue is milky coated in Cali mur. And there is Eustachian catarrh. You know how the Eustachian catarrh patient will come to you. They will tell that, doctor, I have earache. And when we ask them, they will tell, I had throat pain 7 days back. I had throat pain. Now I have got earache. That means when you examine the ear, you don't see any inflammation. The tympanum is intact. There is no pus, no perforation. And when we palpate, we can feel tenderness in the cervical region. And Just have a look at the throat. You can see either pharyngitis or laryngitis, and they may tell that I had infection, I had cold water during a sunny day, and I got infected. That means there is eustachian catarrh. So they will tell this area has pain. So you can give Kali muriaticum, very useful remedy. Now cicuta. Cicuta is a anti-convulsion remedy that often helps in our practice. Bending head and spine backward and violent distortion of the face. That is cicuta. Violent distortion, even we cannot identify the person during the convulsion because the face become violent. Others won't be able to identify which is this person is, like that. And convulsions one after the other. So suppose you give belladonna to a person having febrile convulsion, no result, it again comes, then you can think of cicuta. You can give cicuta 200 in water doses. In fever, water doses was better than any other way of giving medicines, even pills, tablets, and all. The best is water doses. And morning with fever is also seen in cicuta, almost like belladonna. Now the next remedy is stramonium. Stramonium has got profuse sweating but no relief, and they have a delirium, keep on talking, cannot tolerate darkness. Stramonium always need light, but they cannot tolerate glittering objects. That is a characteristic. They need a dim light. In some hotels we see dim light, just like that. They cannot tolerate darkness. At the same time, they cannot look at the light that is too much glittering, and that will disturb, that may even produce convulsion. So they will ask the mother, put the light at the nearby room so that I get the light. I don't want too much light that is disturbing me. That is stramonium. And they have all the just like hyoscyamus, they also having talking. They may even talk bad words. They may even use bad words, just like hyoscyamus. Now next is opium. Opium has got no complaints, no wants. He's happy. Even if they don't pass stools, they are happy, just like calcareous calf. And there is stupor. Hot sweat is characteristic in opium. When you feel it, you get the hot sweat. When it is cold sweat, you can think of carbovates. Of course, a few remedies we have like veratrum, ignatia, all these remedies. In ignatia, it is tip of the nose. So we have to differentiate. And in Merxol, it is offensive and no relief from sweating in Merxol. It aggravates. That is characteristic of Merxol. Like that, we have different remedies. And breathing is stertorous in opium. And froth may be there in the opium. So during convulsions, there may be froth. And eyes are wide open. And there is no wants. They don't have any desire during infection, during the disease. Now, nosodes. There are many homeopaths who say that nosodes are not homeopathic. Nosodes are homeopathic provided we don't get the result with the indicated homeopathic remedies. So they also cover a similarity that has some relationship with the disease causing product or disease causing organism. And in that level of miasmatic stigma, nosodes are homeopathic. So no result with other remedies, you can think of nosodes. So tuberculinum is often considered. In my practice, when I don't get any result with the indicated remedy, I prescribe tuberculinum. 200, a few doses, that gives relief many times. In India, in modern medicine, when the fever goes out of control, even after 2 weeks, no relief, they diagnose it as pyrexia of an unknown origin. And what they do is they will give anti-tubercular treatment, because tuberculosis is, even though it is not diagnosed, they just give it because there may be some hidden tuberculosis. Many times that may not be expressed, that may not be diagnosed, still they give it. So in homeopathy as well, we can prescribe tuberculinum as a nosode, because there may be some family history of tuberculosis, or even the same patient might have had some tuberculosis suppressed, and that can come out in the form of a chronic fever, in the form of a continuous fever. So we can think of tuberculinum. Another is streptococci, especially in pharyngitis, laryngitis, or even in cellulitis or impetigo. Children often get impetigo and they get fever, or a pharyngeal that becomes cellulitis and becomes fever. You can think of streptococin as a nosol. And streptococin has really helped, especially in pharyngitis and all, as a nosol. And we have a diphterinum. Diphterinum is another nosode when the fever goes out of control, just like streptococin. How to differentiate streptococin from diphterinum is, diphterinum has got white discoloration of the throat. If you look, it may not be diphtheria, but some kind of similarity will be expressed in pathology. So there may be coating of the pharynx or the larynx. Sorry, not the larynx, pharynx. You can see, or just have a look at the tonsils. There may be white coated. So you can think of diphtheria. Even though it is not diphtheria, the pathological similarity, on that basis we prescribe diphtheria. It works many times. And as I already told, pyrogen, it's a homeopathic antiseptic remedy that can be made use of, especially in fever of septic origin. And this is the fourth one. Fifth one is aware. Aware is also called as tuberculinum avis. It's prepared from the tuberculosis of the bird. And this remedy can be used in our children, especially those children who get recurrent fever with weakness and tiredness. We can think of aware. Normally we have two choice. One is tuberculinum and aware. How I differentiate is, when the child is very irritable, naughty, then first consideration is for tuberculinum. Otherwise, I give aware. And it is written in Boric that if you give aware repeated, means if you make use of aware in fever cases, it will improve their appetite, it will improve their general energy, health and all. Now, remedies to be kept for sure when you manage, when you go for a travel with a child who has got a history of febrile convulsion, you can keep all these remedies. So belladonna, cicuta, stramonium, cuprum, opium, arnica, tuberculinum, and the last one is amyl nitricum mother tincture. You can keep a small bottle of amyl nitricum because it's very expensive. You have to keep in a closed tight bottle so that it may not get evaporated. Many times I have seen amyl nitricum mother tincture easily gets evaporated. This can be used not only in convulsions, it can be used even in cardiac failure, cardiac arrest, even in status asthmaticus we can make use of, even in syncope. We don't know any reason why he is falling. Someone has fallen unconscious. You just take a cotton, put a few drops of, I have amyl nitricum here. You take a few drops of amyl nitricum, then just keep it near the nostril without obstructing. Let him breathe, and that will help relieving. It will dilate the blood vessels. It will dilate the bronchioles. So whenever there is vasoconstriction, it will be dilated. So the cardiac circulation will be starting. And when there is spasm of the esophagus, or sorry, spasm of the bronchioles, it will dilate. So always make use of amyl nitricum in your day-to-day practice, especially when you come with an emergency remedy, emergency situation. And many times this can be called as a magic remedy. I know one homeopath who got wonderful result. He started a clinic, and near to his clinic, someone fell on the road unconscious. So there were a gathering around. He went there with a small bottle of amyl nitricum. Inhalation was done. Within a few seconds, he got up, and he had a roaring practice after that, because people started calling him a magic doctor, because he could wake the dying person up. He could start moving. So always make use of this amyl nitricum mother tincture. And one more remedy, cuprum. I have not given the details of cuprum, I think. Cuprum is an anti-convulsion remedy. Cuprum has got spasm. It starts in the fingers and all. Cuprum has got spasm and coldness, and cuprum has got vomiting. That is characteristic. Repeated vomiting. So just like ipecac, you can think of cuprum in cyclic vomiting condition, cyclic vomiting syndrome and all. So cuprum has got the muscle cramps, just like camphor, natramur. Cuprum has got cramps of the muscle, so that can be made use of. I have just given the brief indications of those remedies, but you have to keep reading. So inhalation or application on healthy skin is the best option during convulsion. So indicated potency can be applied on the body. Otherwise, you can just give drop doses, but make sure that there won't be any choking. Now, points to be considered. Always try to treat the individual having fever, not the case of fever. And detailed clinical examination is very essential and come to a professional diagnosis. Compared to other systems of medicine, homeopathy has got more importance in clinical examination. We don't want diagnose, but we need to see the pulse, what type of pulse it is, what type of breathing it is, because all these things are helping us to select rubrics that will finally help the remedial selection. And when we repertorize, say take minimum rubrics, minimum valuable rubrics give maximum result. Avoid all points told by the patient. Take the characteristic points, take the points that will differentiate one patient from the another patient. So don't take everything told by the patient. The valuable indication. So indication intensity is more important than anything. Just patient saying that I have got so and so problem, that's not important. But his face will tell, doctor, I cannot tolerate, like that. The expression of the patient, hand gestures are very important when they give a symptom, and that has to be considered while repertorizing cases. And give the indicated medicine in minimum dose. Many times it happens, we keep on giving many remedies. First we give belladonna, after 5 minutes no change, we give bryonia. Like that we cover the whole materia medica. Believe me friends, such cases will end up in failure, and finally you will have to refer the case to a hospital. So better you can take the help of your colleague. That's also another option. Otherwise, just observe, give minimum dose, wait and watch. And placebo is very important, because many patients having a feeling that when the fever goes high, I must take the medicine every 15 minutes. So you can think of giving a placebo pills, bland tablets or sugar of milk can be given, or medicated homeopathic pills without medicines can be given, or you can give some water with a few drops of rectified spirit if you are available, so they can take every 15 minutes, they will be happy. And of course, another option to give a homeopathic remedy is by water doses. So you can take a bottle, put 1 or 2 drops of the medicine, and ask them to give 10 downward stroke, and from this, 1 spoon can be given every half an hour, like that. Before giving the medicine, every time they can give 10 downward stroke. So that will work slightly in a higher level, as Hahnemann said in his last edition of Organon. Avoid frequent change of remedy. This can lead to difficulties and failure. And this happens when we treat our family members. Many times when we homeopaths, when our child is suffering, we give one remedy, we keep on giving another remedy, like that. I have seen homeopaths keeping case papers for their patients, but they don't maintain case sheets for their family members. So please take this as a message from me. Always you keep a small book for your family members. So only for them you have to keep a book, or you can just keep a file in your computer. Whatever medicines, all the history you can just maintain, so that you can just go through the case after a few days or months. Otherwise, you will forget. So all of you make a file exclusively for your family members, so that you get the history in sequential order. And in case you take the help of a homeopathic colleague, this information will definitely help. And avoid frequent repetition of a similarly indicated remedy. If you are not sure about the remedy, you just give one remedy, one dose, and wait. That is better option. And watch out every dose and decide whether to repeat or not. And once the homeopathic aggravation start, immediately stop the medicine. You can ask the patient to take the placebo pills, no issue. But better stop taking the next dose, or even in water. When you give water doses, ask them to stop that remedy. ask them to take only the tablet, which may be a blank tablet as a placebo. Otherwise, once the homeopathic aggravation starts, it may again complicate. If you further too much doses will spoil the susceptibility, and that will act on another plane, and the person may come with medicinal aggravation. So we have to differentiate what is homeopathic aggravation. Homeopathic aggravation is when you give a remedy, already existing symptoms will slightly increase. That's homeopathic aggravation. But the patient will tell that, doctor, my fever is slightly increased, but I feel little better. I could have my food. I could walk around my room. That means patient is feeling better physically, mentally, and emotionally. That means there is homeopathic aggravation. But when some new symptoms comes, that is not homeopathic aggravation. It may be either a disease aggravation or a remedial aggravation. That we have to differentiate. And always take care of a partially similar remedy. Hahnemann has said repeated use of partially similar remedy is dangerous. So just if you feel that this remedy is partially similar, just give 1 or 2 doses and wait. That is better option. Don't frequently repeat. When you are very sure, you can give the water doses every half an hour till the patient is feeling better. Once they are better, stop the remedy. And general points: if no result, do the investigations and diagnose. This is the mistake we homeopaths do. We keep on changing the remedy, we keep on repertorizing, but we don't diagnose the disease. And finally, at the terminal stage, they will go to a physician and they will diagnose, and our system will get blamed. Never do that. So always diagnose the disease. Once you diagnose the disease, forget. Then you think about the individual. Then you can correlate whenever you need to know the pathology for a selection of a remedy that covers the pathology. Then you think about the disease condition or the person is suffering. Otherwise, don't blindly prescribe on the basis of disease diagnosis. So always homeopathic way of prescribing is important, but be a doctor first. So we have to diagnose. And complete blood count is must. Monitoring platelet is very important, especially in India. At the present situation, when you get a fever goes and again fever comes back, immediately refer the patient for platelet count, because platelet count may be reducing. So there may be dengue, because we have now dengue season. Platelets count must be monitored, and we have many remedies to increase the number of platelets, like X-ray. We have a eupatorium that helps many times. So different there are many medicines, and we have a Tylophora. Tylophora is a very Indian remedy that is said to increase the platelet count. And we have Carica papaya, that's also available in homeopathic pharmacies. So you can make use of all those remedies that will increase the platelet count. Okay, and tell the patient to come directly for consultation, because others may not give the PQRS. So let the patient come. If it is not possible, ask them to record the video of the patient and bring. That's very important. But at this time of COVID, don't handle the mobiles given by the patient, because I always ask my patients to the bystander to get the video, but never use the mobile, never handle it. So ask them to keep the mobile in the hand, and we don't touch it. Just have a look at the video. That's all, because COVID can spread even through the mobile. Many things are not clear, so better not to take a risk. Okay. And the medicine selected by guessing may not hit the target, but a failure will definitely hit the doctor's reputation. So especially when you manage a febrile convulsion, failure will have a negative impact. So such cases, if you don't get any result, you better refer such cases. And when there is history of febrile convulsion, drugs like cicuta, belladonna, stramonium must be given. So you must have these 3 remedies: cicuta, belladonna, stramonium. These remedies are going to help you. Sponging the armpit, forehead and trunks using warm water may be very useful. So please remember, when the fever goes out of control, you don't get any result with the remedies, still the fever is going, the child may get convulsion. At this stage, you can use sponging is okay. Use warm water, lukewarm water you can use instead of cold water. Many people do cold water sponging, and that will irritate the child. They may even cry, they may even get convulsion. So make use of lukewarm water, so that will never irritate the victim. Once we apply, and gradually this water will become cold, and that will remove the temperature. Excess of heat will be removed from this water by this water, because water needs temperature to get evaporated, so that will absorb excess of heat and person will not get convulsion. So that you can make use of. Never use cold water. Of course, in hyperpyrexia and all, they directly put the patient into an ice cold room with ice blocks around. That is indicated, that is needed to save them, but otherwise you can suggest lukewarm water sponging. And gruel is the best remedy. In other places you may call it as khichdi, or gruel is the best. Rice and all, salt it has got, and it will give essential electrolytes and sugar. And physical and mental rest is very essential. However, patient need not be in bed, so you can ask the patient to move around. No need to be in bed, on bed. If vomiting, give coconut water in sips. Whenever there is vomiting, ask the patient not to drink the whole glass at once together. If you drink it, it will dilate the stomach and vomiting is possible, reflex vomiting. So ask them to take sips of water little by little. This can be tried even in diarrhea cases. If you try homemade ORS in little by little water, it won't produce vomiting. So no, you need not even admit the patient for IV fluids and all. But many people, what they do, they just take the whole glass and immediately vomit. So little by little is the best option. And personal hygiene should be maintained, and bathing in lukewarm water is beneficial during fever. So many times people don't take bath during fever. No, you have to ask them to take shower. That is very important. Except ask them not to use coconut water, coconut oil and all. Many times, especially in India, especially southern states, everybody will use excess of oil on the scalp, and during fever better don't use it, because that will obstruct normal sweating from the scalp, and better don't complicate. So avoid using oils, but they can take baths twice daily. And And my experience is, by doing a statistical analysis of the cases of fever convulsions treated so far, I have noticed best result in cases treated with minimum dose of the indicated remedy. So even without mother tincture and all, we can easily manage with the indicated potency. Now, homeopathy is the best even for pyrexia of unknown origin, which comes to us from super specialty hospitals. Many times we get cases admitted in super specialty hospital, and the family members will tell that it is diagnosed as pyrexia of unknown origin. They are about to start the steroids. They are about to start the anti-tubercular treatment. What can you do, doctor? Please help us. So under such situation, we can prescribe with very high confidence, because already they are in a hospital, they don't get any result with their treatment. So we can, with confidence, we can prescribe whatever indicated remedy can be prescribed, just by even by a phone consultation. Many times we prescribe, but possibly the best option is to directly visit the patient and take the case. Unfortunately, in this busy world, we don't get time to visit the patient. In our history of homeopathy, we see many pioneers like Hahnemann, Kent, all. They used to visit the patient and prescribe, because visiting a patient, his room, we see the surroundings, and we easily develop a rapport with the patient, and the result will be better. But in this busy world, that is not many times possible. So this is some of the cases. Acute pyrexia with history of febrile convulsions. So he was brought to me. His parents told me that he has got history of convulsions. So we always carry anti-convulsion medicine, sodium valproate. If he gets fever, immediately we start giving. Otherwise, he may get convulsions. So I was little bit worried about him, but I just wanted to try. So his characteristic, he was using bloody language, abusive language. Even in front of me, he was using language, that kind of language. When I was trying to examine him, he was scolding me in an abusive language. because his father is basically alcoholic, and evening he comes under alcohol intoxication. He starts singing all the bad songs and all. So the child knows everything, because the child will record all those things and repeat whenever their situation changes. So we learn many bad things from the parents, such cases. So I had to advise the father that if you want to drink, you go somewhere and drink, next day you come home. Otherwise, don't sing such don't use such bad words in front of your child, because you are just spoiling your child's future. Okay, so mind abusive, delirium, fever during, spitting. He was spitting everywhere, and grimaces. He was just showing grimaces at me. Ill-mannered faces. Fever continued, and there was vomiting during fever. That was the only indications I got. These are the remedies under hospitalization. Belladonna, stramonium, ars, hyoscyamus, nex, lachesis, all these remedies. I took 6 rubrics. That's enough. We need not take 15 or 12 rubrics and get another wrong remedy. So hyoscyamus 1 in divided doses is given. Hyoscyamus also covers convulsion. So in water 1 it was given, and he was better. And after that, I had to prescribe him tuberculinum, and after that he rarely get convulsion. He never get fever and convulsions. And I had to advise the father, and father is under my treatment for alcoholism. Not so easy to manage such cases, because there is history of alcoholism. So I have given him syphilinum, because family history of alcoholism is there. He has reduced intake but still takes, but it takes little more time. So I hope I'll be able to manage him. Now, next is a case of pyrexia of unknown origin, PUO. This is the case that gave me confidence, because Mr. X, he is my friend, he knows me very well. He came to my consultation chamber, and he was very worried. He said that my sister is admitted in the hospital, her wedding is fixed, the date is approaching, but she is admitted in the hospital, and it is diagnosed as pyrexia of unknown origin. And we are thinking of postponing the wedding. Even there is a critical question from the side of the bridegroom's family members are asking, what's wrong with this girl? Even one family member of this boy asked him that whether to go for this marriage or not, such a sick patient, why to marry her like that. So it was uh, for the whole family, it was a painful situation. So he just asked me what you can do, because the hospital people, they are trying going to start tuberculosis treatment, and we don't want to experiment with a wrong medicine. So what you can do? So I asked them, is it possible to visit? But they said no, fever is still there, not in a position to come. So then there is another option is phone consultation. So I took her case over the phone and had a talk with her mother and herself. And the indications I got from them: fever with chills, headache associated with vomiting, pain in the bones with chills, and vomiting of bitter liquids. Very simple. Simple, commonly used remedy, Upatorium perf 200 in water doses every 2 hours till improvement. And they took third or fourth dose. After that, she was better, and he called me, and I said, no need to take. You take the pills. I had also given some pills. So you take the pills. And what really happened was, she got married on time, and both are in abroad, happily living. Now, this is the last case, Kikuchi Fujimoto disease. It is also called KFD. KFD, there is another KFD, Kaisanur forest disease, that is called monkey fever. That is different. This is Kikuchi Fujimoto disease. Simple. In this disease, what happened is there will be pyrexia of unknown origin with swollen lymph node and necrosis of the lymph node. Only one lymph node. Normally, cervical lymph node is affected. It swells, and there will be abscess within the lymph node, and painful. Many times they have to remove it, do the surgery, and they give the steroids. Already they give antibiotics, no result, fever was continuing, and now they give steroids. They are about to start steroids. So the relative consulted me, and I had no more symptoms to take. The girl was in a bad situation. So I was thinking about the pathology. Fever is continuous with swollen lymph node. So there is a tubercular. So I started with tuberculina because nosodes, when you don't have a detailed symptomatology, you can start the case with a nosode, and nosode will give better clarity. So tuberculina was given, and she was discharged because the fever disappeared, and they did not prescribe steroids. And later on, I took her case, and she was found phosphorus. After phosphorus, her repeated episodes of respiratory problems, everything subsided. So tuberculinum really helped to get a better picture of the case, and that was phosphorus. So tuberculinum, a nosode can be given as a nosode, as a homeopathic indicated remedy, and it can be also given as a remedy that will give clarity to the symptoms of the patient. So especially in one-sided diseases, you don't have any clarity, you can think of a nosode. Similarly, when you get a case of sulfur, you don't have any other indication, you can give sorinum as a nosode after sulfur when no result with sulfur. In the same way, when you have a Mersol case, you don't get any result even after repeating various potencies of Mersol, you can give syphilinum a few doses. In the same way, after giving Tuja, you don't get any result, you can give, and medorinum can be given. So as a nosode, this will really help. Even in fever cases, I have already told remedies like tuberculinum, pyrogen, tuberculinum aware, diphtherinum. These are the 4 nosodes you must always keep in your mind. So these are some of my books you might have read. Be a Master of Materia Medica is published by B. Jain. In this book, I have written the indications of Materia Medica with rubrics of those symptoms with other remedies. So it can be called as a connecting link between Materia Medica and Rapid. That is published by B. Jain. And Rapid Prescribing, that's a collection of 3,333 peculiar symptoms that usually help for in our practice. And Drug Addiction and Homeopathy is published by B. Jain. And the 4th one is a travelogue written in our local language, Malayalam. It's titled Kalchagalude Kanapurangal Thedi, published by HNC. And the other one is a Spanish book of translation of Be a Master of Materia Medica, published by B. Jain. And the other 2, Capsule of Materia Medica and All About Abdominal Pain, both are e-books published by familyhomeopathy.com. So these are my books, and I am planning for another book. Work is going on with the support and of another doctor. So it's a co-authored work that will be, hopefully, it will be published by next year. So thank you all for the patient listening, and I think I took little more time.
Oh, that's all right, doctor. I think we learned so much about febrile convulsions that I think you can write a book about this itself, doctor.
Yeah, I'll try. Let's hope for that. Yeah, time
Uh,
permits.
yes, doctor. Doctor, there are a few
Yeah,
people who have asked some doubts. If you look at
yeah,
the
yeah. Ramesh,
question answer,
some if the
yeah.
eruptive fever, measles, repel, getting neurological problems, how much time required to recover from that complaint, sir? Thank you so much. Okay. In eruptive fever, uh, neurological problems may not come immediately. That may come gradually after a few months. We have seen such cases as well. It depends upon the case. We cannot predict when will it happen. But you can give a morbillinum for sure. Just give a few doses of morbillinum. That will give some relief. So I cannot say it will disappear within a few days or months. It depends upon the case. And these are the chronic cases. We have to wait and watch. Anyway, a remedy like morbillinum can surely help. Then follow up case has to be, the case must be studied properly, and follow up management has to be decided. And divided doses, okay, divided doses, Hahnemann said a dry dose in his 5th edition and wet dose in 6th edition of Organo. So in divided doses means we give, suppose in this water, in glass bottle of water, I give one remedy, and patient takes it at once. It becomes a single dose. Instead of that, we just give repeat divided doses. Instead of giving all dose together, we give divided doses every half an hour in a diluted manner. Already the medicine is potentized, but better divide it. Even in the same, when we give medicine in sugar of milk, many doctors do that, especially the senior doctors I have seen. They keep sugar of milk, put one drop and mix it well, and different doses they make, sachet they make and give. But usually divided dose means when we give a water dose, and before giving each doses you can give 10 downward stroke, so the medicine will act in a higher plane, especially in LM potencies. When you prescribe, these divided doses are usually used, so that this liquid can be given, and before administering they can give 10 downward strokes, so the next dose will act in a slightly higher level. Okay, now how to differentiate slow onset fever in children's symptoms? Yeah, in slow onset fever means gradually the symptoms will come, and it may not go chronic. The fevers start, they suddenly they may have a, they may not have infection like in belladonna and all. So gradually the symptoms will appear. So remedy like bryonia can be considered. How you give dry dose in olfaction methods? Yeah, olfaction method I give only by uh, dilution. You can put in a cotton and inhalation. That is the only way. Dry dose, we cannot ask them to inhale this sugar of milk or tablets or powdered, because that will produce obstruction. That will irritate the patient. So when you give inhalation, the only way is take cotton, put a few drops of the dilution or even the mother tincture, and ask them to use. And I use ambu bag for giving first aid and all. So you can put a few drops of the medicine in the ambu bag, and that can be given for breathing. How much ml of bottle should be used? Normally you can use 30 ml bottle, that's enough. Don't give a 100 ml bottle to a patient, because they will misuse the remedy and the water will get spoiled. So 30 ml bottle is better. So you can, or even 10 ml can be given. You can ask them to put that in a glass of water and take it, that's okay. So don't give a large bottle like this, because they may misuse it, they may take it for a long time. So 30 or 15 ml bottle is enough. Yeah, in divided doses, then you can ask them to prepare, but tell them to discard the old medicine, because that may spoil. If you put excess of spirit, many times doctors do that, put medicine and 10 to 15 drops of the spirit, that can be kept for a long time. Otherwise it may get their fungal infection may take place. Otherwise you can ask them to keep in the refrigerator, so that it can be used for long. Okay, I think it's already time.
Yes, doctor. Thank you very much
Okay. Yeah,
for the
thank
time
you
you've
and one and
given
all.
us. Yeah.
Yeah,
Thank you,
sure,
everybody.
sure, sure.
And
Bye.
I
Take
hope to
care.
see you
God
next
bless.
week on Wednesday. Thank you.
Yeah, sure. Bye. Take care.
Bye bye. And for all the people who are here, we have another webinar on Wednesday at 7:30 with Dr. Shah, telling us, giving us knowledge about how, what we should be to be like, what should we be to be like Dr. Hahnemann. So we'll be sending you all an email, and hope to see you on Wednesday at 7:30 India time. All right. See you, everybody. Bye bye.